This is the teaching section of your home exercise program in which we'll start with resting in a comfortable position, supporting and protecting the arm. Initially, after shoulder surgery, you'll want your arm supported and protected. The sling does this very well. From time to time, you can rest out of your sling as long as you keep the arm supported, like this with a pillow, and protected, and avoid using the arm. While resting the arm in a supported and protected position, either in the sling or like this with a pillow, you can adjust the arm into slightly different positions for comfort. You can use ice to manage your pain and inflammation while resting. We'll continue the teaching portion with shoulder posture and low-level exercises. These exercises that are to follow can be performed in or out of your sling, in sitting or in standing. When sitting, either in or out of your sling, avoid slouching. Work on sitting up tall and straight in good posture. You'll want to avoid the slouched posture in or out of your sling and standing as well, working on standing up tall and straight with your shoulder blades back, stomach in, chest out. Diaphragmatic breathing. Again, either in sitting or standing, in or out of your sling, work on diaphragmatic breathing, where as you inhale, your belly pushes out, and as you exhale, your belly comes back in. Work on breathing in through your nose and out through your mouth. Neck range of motion. In standing or sitting, you can drop your neck downward as you exhale, stretching the back of your neck. Inhale as you come back up, and then work on your side bending. Exhale as you side bend to one side. Inhale through your nose as you come back up. And then exhale as you gently tip your neck the other direction. Combined with your breathing, you'll also want to work rotations. First to one side, exhaling as you rotate your neck. Inhaling as you come back to center. And then rotating the other direction as you exhale. As mentioned earlier, these exercises can be performed either in or out of your sling, either in sitting or standing. Thoracic range of motion. The shoulder is heavily dependent on the mobility in the thoracic spine. Your thoracic spine extends from your lower neck to your upper back, and it's where all your ribs attach. As you inhale, come to center. Exhale, rotate through your thoracic spine to give it a nice stretch. As stated earlier, you can do this either sitting or standing in or out of your sling. Shoulder blade motions, either in or out of your sling, sitting or standing. The shoulder blade is what the arm bone is attached to at the ball and socket joint. You'll want to work these shoulder blades in different directions, raising them up, as well as rounding them forward, working on your breathing throughout. Inhale as you squeeze your shoulder blades together in this position. Exhale as you come back to neutral. Repeat the series focused on your breathing. Inhale through your nose as you raise your shoulder blades up, and exhale as you relax them back down. Inhale as you round your shoulder blades forward, and exhale as you come back to neutral. And once again, inhale as you squeeze your shoulder blades together, and exhale as you relax back to a neutral posture. Elbow motions. With your palm facing inward and your thumb pointing towards the ceiling, keep your elbow at your side as you bend and straighten your elbow. This will keep your elbow loose and avoid any contractures or tightness within the elbow as you heal. Keeping the palm faced in and the thumb towards the ceiling will help decrease stress on the bicep. Hand and wrist motions. Resting in your sling or supporting your hand with the other arm, work on bending the wrist in and out, turning it palm up and palm down, opening and closing the hand, and tipping the wrist up and down as if you were to have a hammering type motion. You can repeat these exercises in any given order, just working on keeping the hand and wrist nice and loose. Gentle shoulder motion. Using the other arm to assist, position the injured arm on a tall countertop, or in this case, the back of a tall chair. As you rock your body backwards, you can lean your shoulders forward to get motion throughout the shoulder. Stand up tall with your elbow at your side, and then step backwards and drop your shoulders and chest down so as to get some motion within the arm. The shoulder should remain relaxed throughout this entire exercise. Only step back and lean forward enough to where you get some motion in the shoulder without causing yourself any significant increase in pain. You can rest in this position and work on your breathing. This exercise can be progressed over the next few weeks as your shoulder continues to heal and gain motion as you drop your body back further and your chest down to get full motion within the shoulder in a relaxed position. Take care not to push it too far too soon. When you're finished, step back up towards your arm and help it down with the uninjured arm. This is the touch portion of your exercise program as we teach you how to do self-massage, which may or may not include the assistance of somebody else. Once again, in standing or sitting, in or out of your sling, you can reach across with your uninjured hand and work on gently massaging the upper chest, the bicep and the arm, and the upper neck and shoulder region. Take care to avoid massaging directly over any incision and or massaging so hard that you cause yourself a significant increase in pain. Thank you for your time. We hope this teaching serves you well. We wish you luck with your rehabilitation, and if you have any specific questions, please contact your therapist and or surgeon.